and I would like to take this opportunity to speak about some issues that are particular to my electorate of Mayo. In Mayo, access to healthcare is the most common issue raised with me by constituents. For those who are unaware, Mayo stretches from the southern townships of the Barossa Valley throughout the Adelaide Hills and the Fleurieu Peninsula, out to the lower lakes towards the east and across, and includes Kangaroo Island. The majority of Mayo is regional, and the challenges in accessing health services reflect our regional status. And I would also say that for South Australia, Mayo has the oldest, on a per capita basis, for population. So we have a very old population as well as a regional population. In Mount Barker, the local hospital has recently installed a service that sees a doctor overnight. This hospital has a catchment area of 70,000 people, and it is the closest hospital for people who live 20 kilometres north or east of Mount Barker. And until 2 weeks ago, if you were sick in the middle of the night, there would be no doctor to meet you when you arrived. You would be sent down to the city, and for some people that's well over an hour's drive. And so I remain ever grateful to the State Health Minister, Minister Jack Snelling, for listening to my plea on behalf of my community and months of advocacy in order for us to have an overnight doctor. There is still no renal dialysis service in the Adelaide Hills. Again, this is an ageing population. This is the oldest electorate in South Australia, and we do not have renal dialysis in one of our major centres. And this means that over 1,500 trips are made annually to the city by a patient so that they can receive treatment. This is in an area with limited public transport options, and some people are choosing to forgo treatment because of the burden it is placing on their families. There is no Medicare rebatable machines in the Adelaide Hills region, and this means, again, this is another issue that only regional and rural Australia faces. This means that unless a patient has capacity to pay the $300, they must travel to a metropolitan area. If we had a Medicare rebatable machine, it's estimated that more than 20 people a day would use this. That is how great the need. The Gamaraka medical practice is fighting for funding since the introduction of the modified Monash model in July 2015. In a town of just 1,000 people, the practice extends its services right across the region with a catchment of almost 7,000 people. Under the modified Monash service, the practice has lost funding as it is deemed to be within 20 kilometres of a town of 50,000 people. This arbitrary ruling does not take into account a myriad of factors, including winding roads, poorly lit roads and a lack of public transport options. Gamaraka sits at the top of the escarpment of the Mount Lofty Ranges, and travel to the city is not an easy thing. I've written to the Minister regarding this matter, and I intend to continue to advocate on behalf of Gamaraka Medical Practice. They offer services far beyond what would be expected of a small country town GP clinic, including providing training opportunities for 40 general practice registrars since 2003, and are struggling to maintain these services with reduced funding. As one of the only medical practices in the region that offers 24-hour care, it would be another blow to our regional community if they were forced to scale back. At the southern end of my electorate is a township called Yankalilla. And the Fleurieu family practice is also struggling to continue its services after it was informed that its after-hours services funding was being withdrawn. The practice is the only medical facility on the west coast of the Fleurieu Peninsula, which covers an area of approximately 450 square kilometres. It services a population of 4,700 people, but that swells in the summertime to over 16,000 people. In the last 2 years, there have been over 309 emergency presentations at that practice, such as presentations for lacerations, anaphylaxis, chest pains. Should the clinic be forced to stop its after-hours services, some patients would have no choice but to drive south over 30 kilometres to the Victor Harbour Hospital, or north more than 50 kilometres to the Noarlunga Hospital. In both directions, there is no public transport. And I've been talking about primary health care, but I'd also like to talk about mental health services in the region. My whole electorate does not have a headspace. Mental health services in regional Australia are woeful.